Hi, everyone. I'm Oded Eran, co-founder and CEO of Connie Health. At Connie Health, we help older Americans save money and get better care by helping them find the best insurance for their needs and the best doctors available for them so they can get the care and afford the care that they need. Today, I'm joined by David Luna, my co-founder and the president of our company. And today, David, we're going to talk about a topic that we get a lot of questions about, and this is
Ah,
what's up with all these Medicare commercials, the Joe Namath, William Shatner commercials, Jimmy Walker. Why are all these companies using old school celebrities to advertise Medicare? So, David, my first question to you, are those advertisements legit or is that a scam?
so, man, that's a tough question. You always put me in that corner and and put me up against a wall. The short answer, Odette, is no, they're not scams, right? I mean, in order for them to have a commercial to begin with, they have to be approved through Medicare to have those commercials. So the commercials are legitimate. They're not a scam. However, the benefits that they offer may not always you may not always be eligible for those benefits, right? So it is a technique, when hiding behind. I say hiding. I guess it's just having a celebrity at the forefront rather than having somebody person to person. It, they're trying to get the phones to ring. They're trying to make you call them.
Yeah, and there's no shame in that. Yeah, they're trying to get the phone to ring. And I think what we hear often is customers call in, oh, these they're promising to put money back in my social security. Am I eligible for that? And most often the answer is no. They're targeting people with who are eligible for extra help with these benefits that get the phone to ring. And yeah, it is compliant, but most likely when you see that commercial, you're not eligible for those um, those flashy benefits. David, you've been doing this for 20 years. You've helped thousands of people on Medicare. For those people watching those commercials at home, what's your recommendation? How should they interpret what they're seeing on TV?
Well, listen, at times I see those commercials and I even want to make a phone call, right? Because they sound so
Yeah,
good. The
give
benefits.
me
I
money
can't wait.
back.
Yeah, I can't wait to be Medicare eligible, right? And so, but all I can say is be careful when you call these folks. It is a call center. They are trying to get you to call in. If you're not eligible for the benefits that they're talking about on the phone on the television, you know they may switch to, hey, but you are eligible for this, what do you think, let's talk about it, right? And so be very careful on that. For somebody like our agency at Connie Health, we believe in local support, so we have local agents there that live in your community. If you need to get a hold of us, you can get a hold of a live body, you can get a hold of some of our support staff. It's not so with a call center. Call centers are very large. If you end up enrolling with somebody into a plan, the odds are of it reaching that same person again are very slim.
Yeah.
So
And
yeah.
and we do, like, at Connie, we do deal with a lot of people who um have put on a suboptimal plan by calling this 1-800 number. They all of a sudden they realize they're on a plan that they were not really sure uh, that they actually enrolled in, or that doesn't
Mhm.
accept their PCP, or all of a sudden they're paying way too much for their drugs. Um, yeah, that's like that. Those are stories that we hear all year round, right, David?
Yeah, and there's a trade-off. You mentioned earlier getting money back in my Social Security. That's great and all, right? I'd love to get some money back in my Social Security, but there's a trade-off to that, right? Your prescription drugs copay may be higher. Your hospitalization copays may be higher. They, as you mentioned, they may not have your providers. Excuse me, I do have, I won't mention any names, but there was a particular case where we spent several days trying to get that person back on the original plan. They literally called in, they put them on a plan that wasn't even in their county. right? And so when they
So,
say, "Give us your zip code," why? You put me in the wrong plan anyway.
well, so David, talk about that. Like that person that we had to help them go back to to the original plan. What would have happened to them if they end up at the hospital? Like, would they have no coverage?
There would be no coverage, Oded. I mean, that plan literally was not in that county, so they could simply wipe their hands and say, "Sorry, we don't know why you enrolled on this plan."
Yeah.
And keep
When
in mind, they go ahead.
Yeah, one of the craziest stories that I've heard. I actually heard this from a CEO directly, a CEO from a large health plan. He told me that they found out that customers who are on a Medicare supplement plan are calling in because of the extra dental benefits,
Mhm.
and they are being put on a Medicare Advantage plan without knowing that they will no longer have their Medicare supplement plan. So somebody's offering them thousands of dollars of dental benefits for zero, and customers are like, "Oh yeah, that sounds great." They sign up, and they don't realize that they have now lost their Medicare supplement, and if they want to go back, they have to go again through underwriting and have like a pretty big increase in their premium. So that's one of the things we've heard a lot about.
Yeah, I mean, that's another word of caution, right? Be careful when you're switching plans because you may not be able to go back to the plan that you originally had. And so, it's always nice, again, to have somebody that's local that you can reach out to that is able to sit down with you for, if it takes an hour and a half, so be it. But we want to explain to people what are the pros and cons of these plans that you're looking at, and which one is best for you, right?
Yeah.
So, and I think for call centers, and correct me if I'm wrong here, I could be speaking way out of turn, but call centers are timed, right? When you take a call, you can't be on that call for an hour. You better be getting that next call and getting that next sale.
Yep. Um, Yeah, that is absolutely right. Um, Again, thank you, David. This really is a big topic. I know this top of mind for a lot of members and a lot of seniors out there. What exactly are these Medicare commercials all about? And just maybe to sum it up, there's nothing necessarily illegal in them or non-compliant, but this is a really it's like a really big case of buyer beware. Beware of customers hiding behind celebrities, companies hiding behind 1-800 numbers. From our experience, it's always been, the best outcomes are reached by working with somebody that's a local agent that's expert in your local healthcare landscape and is somebody that you can call if you have any issues, if you need any customer service. That's obviously something that we offered Connie Health, but other local independent agents do as well. And so that is always our recommendations to friends and family. Work with a local agent, an independent agent. That's how you will typically get the best deal and be able to have service after you enroll in a plan.
Yep.
Um,
It all
Thank
sounds
you,
good
David.
until you have to use. Oh, go ahead. Sorry.
Yeah, no, exactly. It all sounds good. Everybody's
Until
friendly when they're trying to sell you a plan. What
Well,
happens
yeah, and
after you enroll? We
right.
always tell our customers that.
Yeah,
Uh,
it all sounds good until you have to use the benefits, and then you're like, "Wait a minute, what happened?" Right?
mm,
So, yes, beware, buyer beware, and thank you, Odette. I think this was, one of our most important topics that we've talked about so far.
Wonderful. Thank you, everyone, for tuning in with us today. I'm Oded Eran, co-founder and CEO. My partner, David Luna, co-founder and president of Connie Health. If you like what you've seen, please follow us on social media or come visit us on our website or give us a call. We'd be happy to help you in any way, shape, or form we can.